Hey, I'd like to welcome you to another episode of the Mission Matters Innovation Podcast, your source for everything innovation. I'm your host, Adam Torres. You can follow me on Instagram at AskAdamTorres to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, moneymatterstoptips.com, and click on Become an Author to apply. All right, so today is a very special 2020 reunion episode. What is that? That's when I had on a guest in the past, and I liked them so much I had to invite them right on back. So today's guest is Sam Terese. He's president and CEO over at Alverno Laboratories. Sam, welcome back to the show.
Well, thanks, Adam. I'm thrilled to be back. I think it seems like just a little while ago that I was on the phone with you, but it's a few months have passed, and I'm looking forward to another lively discussion.
Oh, man, happy 2020, new year, new decade, and I'm excited to get into what Alverno's up to, and also, we're going to talk about highlights of expanding technology, so all great stuff there. But before we do that, I don't want to assume that our new listeners caught your first episode, so let's just start out with you talking a little bit more about what you're doing over at Alverno Laboratories, please.
Yeah, so as a member from Alverno Laboratories, or we like to call it just simply Alverno. And we're in that kind of unique space in healthcare where we kind of live a little bit behind the scenes, but we're the folks down in the laboratory that are doing all the tests that are helping physicians and other caregivers really determine kind of the diagnosis and treatment of the patients they're seeing. So the list of things we do is never ending, and probably the most of your audience who's ever had their blood drawn. That's we're the folks that actually come and do that, and actually then take those samples and get you those results that tell you what's going on with your health.
So let's talk a little bit more about expanding technologies and what Alverno's up to. So where do you want to start?
Well, I think let's talk a little bit. We're in this kind of changing world of healthcare, and so it's been a pretty dynamic environment over the last probably decade. And you see that when we're all kind of, or at least I grew up with the little community hospital that was in our town or wherever we lived, and that's where we went to get all our care, and that's pretty much the environment of healthcare today. Those laboratories or those little hospitals don't really exist, but may be part of very large kind of regional networks of hospitals with large systems. And Alverno's kind of functions like one of that, but we only do that in the laboratory space. So, in addition to testing, we kind of own and operate multiple hospital laboratories. And by doing that and kind of doing this in a regional way, we're really able to focus our energy on really developing and launching new technologies and new testing to better support the care needs of our patients. So some of those examples might include some of the advancements we've done in an area called digital pathology, which is a rather difficult topic to explain, but think about it in this way. Once upon a time, we all had cameras, and we took pictures, and we took that film to the drugstore or to the local photomat, and we got those pictures developed. And nowadays, we take our phones, and we have instant pictures. So what we're doing in digital pathology is kind of making that same kind of leap, where things were looked at on a glass slide under a microscope. Now they're scanned by very sophisticated equipment, and we create a digital image that we can basically beam to anywhere in the world, so we can get information to all the experts no matter where they are. And some other things, we've done a lot with infectious disease in terms of all those different things that you take antibiotics for. Well, somebody has to determine what they are, so we've advanced technology so that we're able to get those answers back to clinicians much quicker, sometimes 1 to 2 days quicker.
Wow, that equates to much better care. If you've ever had to go to a clinic or anything else to get blood drawn or testing or something else, and you used to have to wait like a long time, 1 or 2 days can mean a long time if there's some type of treatment or medication that needs to be prescribed, right?
Oh, especially true in infectious disease. I mean,
Yeah.
it could be a matter of life and death.
That's what I thought.
So, if you can get somebody on the correct antibiotics sooner, the odds of them getting better before the infection, moves to a much more significant level, greatly improves. So, huge advantage. Other things, we're all fighting, the crisis with opioid testing, and so as a regional lab, we're able to bring in technologies to better determine, what potential drugs a person might be taking, not necessarily from an abuse perspective, but even kind of accidentally taking.
Mm-hmm.
I used my story of my was then 90 plus old mother. And she had her little pill boxes, but always kind of a little difficult when they know what they're doing. They kind of know what the pills do, and so they have those days where I feel this way. I might take an extra one, or I might not take. So knowing what they're doing is what we were able to do with the advanced drug testing we brought into the market. And then there's the whole world of oncology and really understanding at the level of the gene and the DNA in terms of better to determine what kinds of therapies patients would use. So a lot of advancements in the last year for Alverno.
Man, I love this. And I mean, some of the things I like, but I tell people this all the time. I mean, my vantage point of being a podcaster, I love talking to people that are doing advancements in the healthcare industry, because I'm like, we're all going to need these one day at some point. Or if we don't need them, our loved one, our family, somebody's going to need it. And like, it's huge, like to have people doing these breakthroughs, like that 1 to 2 days of testing things to potentially save lives. I mean, that's huge. And I look at it as it gets better and better. I'm like, oh man, what's next? I love it. Keep on doing your work, Sam, because I might need you one day. I won't even know that I'm using you, but the hospital or whatever I have to go to will be using you on the back end, and one way or another, we all benefit from this cumulative effort of work that's going on in the healthcare space. It's amazing.
Yeah, as being a little bit older, I maybe I have an alternative motive of trying to do this for myself.
Faster, a little bit faster, maybe.
Yeah, because it is a correct statement. We all are going to need health care at some point.
That's awesome. So what, you have a lot going on, by the way, and you gave us a lot already, but I'm just going to push you a little further. What's that one thing that just excites you right now? Like that you're just like, man, this is the best. This wakes me up in the morning, because I know you have a passion for what you do. What's that one thing that just gets you fired up?
Well, it's always very hard to come up with that one thing, but
that's why I asked it. I'm sorry.
I know it's a really tough question.
Sorry, I apologize. Not easy podcast. I know.
No, I've been doing this for so many decades, and it's
I know.
on any given day it could be something new. But I think it's just that exciting fact that you realize that what you're doing and what your team of professionals are doing is really things that matter. Things that have an impact, whether it's even a simple little modification to a test, or just adopting some sort of technology and knowing that and being able to tell people this is what we're doing that makes a difference. Intriguingly enough, it's not necessarily always about the business side of it and the dollars and cents, but it's really about making a difference in patients' life. And if we can think of any one thing to do on any given day that kind of moves us forward as Alverno, that's a really great day. So,
that's awesome.
Yeah.
Well, hey, Sam, if somebody's listening to this and they want more information on Alverno or to learn more, what's the best way for them to do that?
Well, in this day and age, it's always come to our website. So it's Alverno Labs, all one word, .com. So ALVERNO Labs.com. And that will take you to our website, and you can find all the information, and even some of the things and the advances that we've done are there on our website and our media. Also, our phone number and anything else that you might want to know about Alverno is there.
Fantastic. Well, hey, Sam, been awesome having you back on the show and catching up with you on this 2020 podcast family reunion, as I like to call it. So awesome having you back. And to the audience, as always, thank you for tuning in. I hope you had a lot of fun listening to this. Hope you got a lot out of Sam and my talk. And if you did, don't forget subscribe. Leave me some comments. If you're watching this on our YouTube channel, Mission Matters Innovation, give that a subscribe and leave us some notes on this video. Let us know what you think about healthcare innovations. Let's keep the conversation going. Love to hear from you. And Sam, thanks again for coming on the show.
Right. Thanks for having me, Adam. Always a pleasure. Looking forward to 2021 anniversary.